Hello everyone, this is Regina Callion from www.remarreview.com, and we're going to go over some NCLEX questions to see if you're really ready for NCLEX. You guys know the questions are so important to test your content knowledge, so let's get right into it. The first question says, if a nurse threatens to restrain a patient due to uncooperative behavior, this can be considered which of the following? A, neglect, B, assault, C, battery, or D, insubordination. If you want to take a second to pause the video to think about it, go ahead and do it, but I'm going to keep going. Out of these choices, the correct answer is going to be B, assault. Okay? Anytime you see the word threaten in an NCLEX question, I want you to think assault. The next question says, a nurse is caring for a client who is receiving prescribed oxygen therapy. Which of the following indicates the equipment is not functioning properly and requires immediate attention? A, a client with a partial rebreather mask and a reservoir bag that deflates with each inspiration. B, a client with a nasal cannula therapy on 3 liters with a pulse oximetry reading of 93%. C, a client with a face mask delivering oxygen at 6 liters per minute. Or D, a client with a partial non-rebreather mask with the humidifier halfway filled with sterile water. Out of all of these patients with oxygenation therapy, the one who needs immediate attention is the client with the partial rebreather mask. His reservoir bag is deflating. The reservoir bag should never deflate. Moving on. 3. A nurse's aide is assisting a registered nurse with an admission. The patient has a diagnosis of congestive heart failure and multiple seizures. Which of the following tasks should the nurse's aide complete? Select all that apply. So we have A, adjust the client's bed to a semi-Fowler's position. B, orient the client to the call light. C, raise all 4 safety rails. D, explain to the client why the television cannot be watched. Or E, record any bruises that are noted when doing a bath. The nurse's aide can do only A and B. Okay. C, raising all 4 of the safety rails is considered a restraint, so that is not happening. Explain to the client why the television cannot be watched. Nurses' aides cannot explain or do any teaching. And E, recording the bruises would be considered an assessment task, which nurses' aides cannot do. Question 4. A client on a long-term care unit was recently transferred to a skilled nursing facility. The client comes to the nursing facility with a stage 3 dermal pressure ulcer. The licensed practical nurse has just performed a wet to dry dressing application and asked the registered nurse to assess the condition of the patient. Who is most appropriate to chart the dressing in the computerized electronic medical record? A, licensed practical nurse, B, registered nurse, C, wound specialist, or D, charge nurse. That is going to be the licensed practical nurse. Remember, the one who did the task should be the one who documents. 5. The LPN is caring for 4 patients. Which patient should she assign to the unlicensed assistive personnel? A, a client resting in bed who needs a dressing changed. B, a client sitting in a wheelchair who has a 24-hour urine collection. C, a client who is scheduled for a colonoscopy and requesting a rectal enema. Or D, a client with congestive heart failure who requests assistance calculating his 2-gram sodium diet. Out of all these patients, the unlicensed personnel can only care for the patient sitting in a wheelchair who has a 24-hour urine collection because routine collections of urine and stool are acceptable for an aide to do. All of the other tasks would be illegal for a nurse's aide to do. 6. By each task, write who is most appropriate to carry out the listed assignment. Go ahead and pause this video and do it really quickly. I'm going to give you the answers right now. Retrieving a unit of blood from the blood bank, the aide is able to do. Documenting a response to a medication, the RN needs to do that. Obtaining a daily weight, the aide can do that. Setting up suction canisters for oral suctioning is a task completed by the LPN. Orienting a patient to their room, an aide can do. Reporting a change in condition to the physician, the nurse's aide. The registered nurse can do that. Question 7. A client with cholecystitis is taking propanthyline bromide. The expected effect of this drug is to A, increase bowel production, B, decrease biliary spasms, C, decrease infections, or D, improve urine output. Now, this is a medication question. When students typically see this, they feel as though they have to know everything about the medication in order to answer the question correctly. However, this is not always the case. You need to know about cholecystitis. This is what will help you answer this question. So, out of all the choices, cholecystitis is directly related to biliary spasms. So you know that the goal of treatment would be to decrease biliary spasms and cholecystitis. You don't specifically have to even know this medication in order to get this correct. Isn't this good to know for NCLEX? Okay, let's move on. Who should the nurse see first? A 7-month-old female with bulging fontanelles crying loudly. B, a 3-year-old male with a temperature of 38.8 Celsius. C, a 10-year-old female 48 hours after a tonsillectomy who is now confused. Or D, a 9-year-old complaining of stomach pain. I would see first the 10-year-old female after a tonsillectomy who is now confused because there is a change in her condition. She is the most acute patient. You needed to know Celsius to Fahrenheit transition in order to get B. And then A, you needed to know that when an infant is crying loudly and their fontanelles bulge, that's completely normal. So it all goes back to the content. Let's move on. Question 9. A nurse is filling out a family assessment form for her client who has been given admission orders. Who should the nurse consider to be part of the patient's family? A, all the people the client views as family. B, all people related by blood. C, all people who are related by marriage. Or D, all the people who provide care for the client. The answer is A. The client defines who their family is, not you, the nurse. The last question. A nurse is doing an admission assessment on a client who has multiple bruises on her body. The nurse suspects abuse. Which of the following statements is the most appropriate for the nurse to ask? A, are you happy with your home environment? B, do you feel afraid when your partner is around? C, are you being hurt by your partner? Or D, do you and your partner have problems resolving personal conflict? Well, the correct answer is C. Are you being hurt by your partner? According to the definition of abuse, which is intentional infliction of injury, mental, physical, or intentional neglect of care, your questions needs to be based directly on that, okay? You want to get right to the bottom of the issue so that you can document appropriately and have truthful responses. Well, that was my 10 NCLEX Ready exams. If you like this and you want to continue studying with Remar Review, check out the website at www.remarreview.com and get your products and packages there. Thank you for watching my video. Bye-bye, guys.